HHA Practice Test 2026 Home Health Aide, Full Course Client Bathing Techniques. Question 1. What is the recommended water temperature for a client's bath? 85 to 95 degrees Fahrenheit. 105 to 110 degrees Fahrenheit. 115 to 125 degrees Fahrenheit. As hot as the HHA can stand. 105 to 110 degrees Fahrenheit is safe and comfortable for most clients. Question 2. In what order should the HHA wash the client's body during a bed bath? Feet to face. Face, arms, trunk, legs, back, then perineal area. Back first, then face. Legs first. Washing clean to dirty, face first, perineal last, is the standard. Question 3. What should the HHA do to ensure the water temperature is safe? Ask the client to test it. Test it on their own inner wrist. Trust the water heater settings. Use a meat thermometer. Testing on the inner wrist is a quick and reliable way to check for safety. Question 4. How should an HHA wash a client's eyes? With soap and a rough cloth. With plain water, from the inner canthus, corner, to the outer canthus. From the outer corner to the inner corner. With alcohol wipes. Washing from inner to outer prevents debris from entering the tear duct. Question 5. What is a partial bed bath? Washing only the client's hair. Washing the face, hands, underarms, and perineal area. Washing the left side of the body only. Washing the client while they are standing. A partial bath focuses on the areas most prone to odor and bacteria. Question 6. Why should an HHA use a bath blanket during a bed bath? To keep the bed dry. To provide warmth and maintain the client's privacy. To scrub the client's skin. To replace a towel. Modesty and temperature regulation are essential for client comfort. Question 7. What should an HHA do if a client becomes dizzy during a shower? Leave them to get help. Use the call button and help them sit down immediately. Tell them to close their eyes. Turn the water to cold. Safety is the priority, never leave a dizzy client alone. Question 8. How should the HHA dry the client's skin after a bath? By rubbing vigorously to improve circulation. By patting dry gently, especially in skin folds. By using a hair dryer. By leaving the skin damp. Patting prevents skin tears and irritation. Question 9. When performing a bed bath, how often should the water be changed? Only at the very end. When it becomes cold, soapy, or dirty. Every 2 minutes. Never. Fresh water is needed to ensure the client is actually being cleaned. Question 10. Which of the following is a safety measure for a tub bath or shower? Using non-slip mats and grab bars. Allowing the client to stand the whole time. Locking the bathroom door from the inside. Leaving the client alone for 10 minutes. Environmental safety prevents falls and injuries. Question 11. How should the HHA wash the client's arms? From the shoulder down to the wrist. From the wrist up toward the shoulder. In a zigzag pattern. Only the elbow. Washing from distal, wrist, to proximal, shoulder, promotes venous return/circulation. Question 12. What should the HHA do with the washcloth while washing? Make a mitt around their hand. Bundle it into a ball. Use only one corner. Hold it by the ends. A mitt prevents loose ends from dragging on the client and provides a smooth surface. Question 13. When is a sponge bath usually given? When the client is in a hurry. When a full bath or shower is not possible or advisable. When the HHA is tired. Only on weekends. Sponge baths are an alternative for very frail or restricted clients. Question 14. What should the HHA observe for on the skin during a bath? Tattoos, redness, rashes, or skin breakdown, pressure sores. The client's tan lines. Hair thickness. Bathing is the best time for a thorough skin assessment. Question 15. Why is it important to wash and dry under a female client's breasts? To make them look better. To prevent moisture buildup that leads to skin breakdown and yeast infections. To save on lotion. To improve breathing. Folds of skin are high-risk areas for infection and irritation. Question 16. Before starting a bath, the HHA should gather all necessary supplies. Check the care plan for specific instructions. Identify the client. All of the above. Preparation ensures a smooth and safe procedure. Question 17. If a client has a weak side, which arm should be washed first? The strong arm. The weak arm. It doesn't matter. The one closest to the HHA. Usually, the arm furthest away is washed first to prevent reaching over the clean area, but the care plan may specify. Question 18. How should the HHA handle the soap during a bed bath? Leave it in the basin of water. Apply soap to the washcloth, not directly to the skin. Use as much soap as possible. Use the same bar for all clients. Applying soap to the cloth is more controlled and prevents skin irritation. Question 19. What is the very last part of the body to be washed in a complete bed bath? The feet. The back. The perineal area. The hands. The perineal area is the dirtiest and should be last to avoid contamination. Question 20. After the bath, the HHA should document the time of the bath, the client's reaction and any skin observations, the type of bath given, all of the above. Thorough documentation is a legal and clinical requirement.